safety is an important part of your role as a volunteer with Brant Community Healthcare System, as you provide support to visitors, patients, and their families, and help to enrich the hospital experience. In the next few minutes, we will consider various aspects of wheelchair safety as you may encounter it in your daily volunteering routine. We will consider the parts of a wheelchair, how to safely open and close a wheelchair, tips for transporting a patient, setting up a patient to transfer between surfaces, and other special considerations. There are various types of wheelchairs you may encounter within the hospital, including manual wheelchairs, nesting chairs, often called the shopping cart chair, and transport chairs. Although there are many intricacies to a wheelchair, the key aspects you will encounter transporting patients are armrests, footrests, which can be swung outside of the transport and manual wheelchairs, push handles, and brake levers, which differ depending on the wheelchair used. On a manual or transport wheelchair, brake levers are located on the left and right of the wheels. On the shopping cart wheelchair, brakes are automatically engaged. To release the brake, push the bar on the chair forward, then proceed with the transport. To ensure patient safety and avoid a sudden stop, come to a stop first, then release the brake bar to engage the brake again. You may have the opportunity to set up a wheelchair for a patient, or return a wheelchair following assisting a patient, when tips on opening and closing the wheelchair will be of value. To open the wheelchair, stand facing the chair. To ensure your fingers don't get caught, place palms on the outside of the seat with your fingers facing inward. Push down and outward until the chair is fully opened. Place the cushion, if applicable, on the seat. To close the wheelchair, remove the cushion and set aside. Lift the footrests up. From beside the chair, grasp the front and back of the seat and pull upward. Part of your role as a volunteer may include transporting clients between rooms, to hospital appointments, or to their awaiting vehicle. For the safety of the patients and volunteers, volunteers have not been trained and therefore should not lift or transfer patients. When preparing to transport a patient between destinations, introduce yourself and explain to the patient what you are going to do.
Hi, my name is Marina. I'm going to take you down to imaging now.
Okay.
So I just need you to put your feet up on here and just lift up a little farther. That's it. And this one too. You can put your arms on here and just keep them in there. That's right. And I'm just going to disconnect you from here. Comfortable?
Yes, fine.
Okay. Now, there's a brake here, so I'll just release that. And I'll release this one also. Okay. We'll take her down to imaging now.
For transport, assist the patient in placing their feet on the footrests, reminding the patient not to stand on the footrests. Assist the patient in placing their elbows on the armrests. And ensure all tubing, IVs, and clothing are positioned where they will not be pulled out. As you transport the patient in the wheelchair to the selected location, use both hands to push the wheelchair handles to ensure control of the chair. Ask the patient about their preferred speed to avoid the patient becoming nauseous or dizzy. Check ceiling mirrors before going around corners or crossing busy hallway intersections for oncoming traffic to avoid collisions. If a patient becomes distressed or slides out of the chair, immediately locate a healthcare professional or dial 3 for immediate hospital assistance. Please do not put your own safety at risk trying to lift a patient. Some patient populations have special considerations due to their condition. Patients who have suffered a stroke may have residual weakness on one side of their body. Patients may also have less feeling or awareness on one side of their body. For these reasons, do not pull on the patient's affected arm, as it may be weak and unable to support itself, risking injury. Ensure the patient's affected arm is supported and does not hang from the side of the chair, putting it at risk for getting bumped or caught. The patient may have poor awareness of where their arm is in space. Support the patient's affected foot with a footrest to prevent it from getting caught on the ground or by the wheelchair during the transport. Patients who have had a hip replacement have restrictions on movements they are permitted to perform to preserve the integrity of the newly replaced joint. For these patients, the patient's knees should not be raised above the hip level when sitting, nor should they bend more than 90 degrees. The patient is not to pivot on the operated leg when stepping into a vehicle, nor allow the operated leg to cross midline. This includes crossing their ankles or crossing their knees. Although the patient has been educated on these restrictions, it may be helpful for you to know as well to keep in mind when transporting this patient, as they will not be allowed to cross their legs, bend forward to pick something up, or sit into a low seat in the car. As mentioned earlier, at times your role may include transporting a patient to their car when they are leaving the hospital. When a patient is leaving the hospital, ask the patient or a family member to hang on to heavy bags rather than hanging them on the back of the wheelchair. Back the patient into the elevator to allow easy exit and ensure patient ease at being able to see the route traveled. Transporting a patient for discharge does not include taking a patient to the parking lot, but rather to their awaiting car at the hospital entrance. Here, you can assist the patient and their family by helping position the wheelchair appropriately to allow greater ease for the transfer from the wheelchair into the car. Suggest that the client transfers into the car from the road level rather than the sidewalk, as this will be easier to not have to manage the step down. The front seat is preferable. Have the seat as far back as possible, with the seat in the reclined or upright position. Ensure the brakes are on the wheelchair and footrests have been moved out of the way before the patient stands up. The patient will hold on to the back of the seat and the corner of the dashboard to enter the vehicle, sitting on the edge of the seat and then pivoting both legs into the car. Carefully back the wheelchair away from the car and return the chair to the hospital entrance. If you feel uncomfortable with an assigned task, speak privately to the staff member aside from the patient to protect both yourself and your patient's safety. With these wheelchair safety tips in mind, you can ensure you optimize your volunteer services, providing safe care for both yourself and your patient.